Welcome to Mansik Shakti Foundation and its course Mind Sciences for Students' Well-being. I have been discussing with you about navigating challenges of students' life, and one of the challenges we recognized are about mental health. And in the piece of mental health, what we are more concerned about is number of students suffering from mental disorders or mental health challenges. So we want to know and discuss what are these mental disorders, how people develop mental disorder, how to recognize them, and what intervention should be given. So right now our discussion is going to be focused on number of risk factors for mental health. As you know, only about 14-15% people develop mental disorder in the community. It's not a very big number, it's manageable, and we can, by providing early care and recognizing the risk factors, risk situations, we can attempt to bring these numbers down. So if we are able to tell our students to develop mental health and mental strength in a positive manner, and we are able to reduce number of students who suffer from anxiety, depression, alcoholism, tension, stress, then the final numbers will also be lower. But just to make it more personal, that how we should deal with situation and what information, what mental health education should be given so that you can recognize the risk factors. When we say risk factors, these are the situations, causes or factors or any catalytic condition which can convert a person who is vulnerable into a person who is suffering. Or these are the factors which, when they combine with each other, develop the vulnerability itself. For example, somebody may be having a family history of mental disorder, but that doesn't mean that he or she will develop a mental disorder. He or she will remain a susceptible or vulnerable person. This vulnerability gets converted into actual illness condition by number of risk factors. So what are these risk factors? If such a person goes through adverse childhood experience, or starts drinking alcohol in adolescence, or gets a head trauma, or goes through severe psychological trauma, then it is likely that the genes present in him responsible for a kind of mental disorder might get expressed in a given set of environmental conditions. So there are a lot of variables. There is no one-to-one relationship that this is the cause and this is the consequences. That situation is not correct, is not prevailing for all the diseases which are multifactorial. As I have been discussing, mental disorders are truly multifactorial. They are caused by biological, psychological, social, cultural, familial, environmental, and spiritual factors. So let us see what are the risk factors. The first on the list is a traumatic experience, such as a military combat or assault, use of alcohol or recreational drug. A child whose history of abuse or neglect is very important. A few friends or few healthy relationships, a previous history of mental illness or effect of mental illness can be temporary or long lasting. There are situations when somebody develops a difficulty for only few weeks, and many times only few days, and then he had developed the capacity to cope up with the situation, symptoms disappear, but nonetheless he remains vulnerable. Or like most of the mental disorders, these are generally lasting for a long period of time. You can also have one or more than one type of mental disorder at the same time. A mental illness can cause problems in your daily life, such as at school or work or in relationship. In most cases, symptoms can be managed with combination of medications and talk therapy. Signs and symptoms of mental illness can vary depending upon the disorder, circumstances, and other factors. Mental illness symptoms can affect emotions, thoughts, and behavior. Examples of sign and symptom generally include something like feeling sad or down, or feeling confused in thinking, or having reduced ability to concentrate, or excessive fear or worry, extreme feeling of fear or anger or guilt, extreme mood changes, up and down, sometimes very depressed, sometimes very elated, withdrawal from friends and activities. You just don't feel like doing the same thing you were doing. Don't feel like meeting friends, you don't feel like talking to people in the family, and try to withdraw yourself in yourself. Significant tiredness, low energy, or problems in sleeping. Either you sleep more or you sleep less. Detachment from reality, developing suspiciousness or paranoia, hallucinations when you hear a voice which is not around, inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, problems with alcohol or drug use, major change in eating habits, change in sex drive, excessive anger, hostility, violence, suicidal thoughts. Sometimes symptoms of mental health disorders appear as a physical problem. For example, one can develop pain in tummy, like stomachache, backache, headache, or unexplained pains or complications. Mental illness is a leading cause of overall disability. Untreated mental illness can cause severe emotional, behavioral, and physical health complications. These mental illnesses include unhappiness and depressed enjoyment of life, family conflict, relationship difficulties, social isolation, problems with tobacco, alcohol, and other drugs, missed work or school, and other problems related to work or school, number of legal and financial issues, poverty, homelessness, self-harm, harm to others, including suicide and homicide, weakening of immune system, so your body has a hard time resisting infections, heart disease, and other medical conditions. There is no physical test or scan that reliably indicates whether a person has developed a mental illness. However, people should look out for the followings, for some points, as possible signs of mental health disorder. Number one, withdrawing from friends, family, and colleagues. Number two, avoiding conflicts that they would generally enjoy. Sleeping too much or too little. Eating too much or too little. Feeling hopeless. Having consistently low level of energy. Using mood altering substances including alcohol and nicotine more frequently. Displaying negative emotions. Remaining confused. Being unable to complete daily tasks such as getting to work or cooking a meal. Having persistent thoughts or memories that reappears regularly. Thinking of causing physical harm to themselves or to others. Hearing voices, experiencing delusions. All mental processes are brain processes, and therefore all disorders of brain functioning are biological diseases. The brain is the organ of mind. Where else could mental illness be if not in the brain? So these are some of the indicators, signs, symptoms, and brief about something which changes in an individual about mental illness. Generally, if we remember psychological functions and there is a deviation in our own psychological function, then we can remember the indicators much better. These are change in behavior, change in thinking, change in mood and emotion, change in memory and concentration, change in ability to do things or engage or feel happy, and change in ability to function, being productive. And distress because of any of these symptoms, one must screen more thoroughly for presence of a mental disorder or for possibility of a mental disorder in future. So I believe that all the students should be given a screening test for three things: whether they are suffering from a mental disorder at present, if they are under undue psychological stress, and third, are they likely to develop mental disorder in future. We are discussing mental disorder in student population. Continue to watch.